Social Health Authority, which is 14 months old, which has replaced NHIF, which had less than 9 million Kenyans. Today's share has 29 million. Okay? NHIF annually used to collect about 39 billion. In 14 months, share has collected 130 billion, has paid 93.4 billion. It has served 80 million primary health care at facilities, 80 million Kenyans at the primary health care facilities, which is free, funded by the exchequer. For normal delivery, SHA reimburses 10,000 to facilities. Now, because of greed and because of fraud, and facilities are, some of the people are not intelligent, the WHO and international standard is that C-sections is between 10 to 15%. So you'll find a facility submitting 99% of the deliveries in their facility was C-section. The system says no. This is again is the international standards. That's number one. So SHA will not, that set of claims is rejected. Two, even you, a claim form is a legal document. It's attached to the Social Health Authority and Social Health Insurance Fund legal documents passed by Parliament. Now, if you go to your, for example, to your doctor in Nairobi, in Karen Hospital, in Aga Khan, the claim form is filled by three different sets of people. The patient, you fill the first part, your name, your BO box, blah, blah. The second part is filled by your doctor. And the third bit is filled by the hospital administrator, who will ultimately work with the claim officers in that facility to ask for reimbursement. So what happens when all the claims from a particular facility is filled by one person, same handwriting, same biro pen? That claim form is automatically...
How can you tell? How can you tell it's the same person, same biro?
You can tell the handwriting. What's wrong with you? You use your eyes. The handwriting of a doctor, the handwriting of a patient, the handwriting of a hospital administrator cannot be the same. What's wrong with you? Have you gone to school?
Yeah.
Yeah. It depends on your grades in handwriting. Secondly,
yes.
And let's continue, when you claim for a surgery, and you have seen when patients are being wheeled to theaters, there's a file on their bed.
Yep.
Those files are called theater notes. And the doctor, after he does the procedure, he will fill, and those are what we call theater notes. For this insurance company, for the social health insurance company to pay you, to reimburse you after you claim, you must provide theater notes.
Right.
Okay?
Yep.
So if theater notes are missing, then will SHA pay? No.
So how come they got away with this?
Just a minute.
How was this looted? That's
just
what
a
I
minute.
want to know.
That's rejections. The 11 billion is rejection.
Well, it's not rejection. It was looted.
By, when okay. Now let me help you with this headline. I can see you are referring to it many times.
Yes.
So that we move.
Yes.
When we rejected 6.8 for private health facilities, 2.8 for public health facilities in the counties, 500 million for the referral hospitals, 1.1 for faith-based. When you combine, it comes 11 billion. Ideally, they were to be paid. Am I right?
Right.
But from where we sit, what they were doing was, if we paid this, then they were looting the social health authority. Okay? So they wanted to loot 11 billion from the social health authority. What helped us is the system, which was not there during the defunct NHIF. So the fraudulent characters who are working with the insiders within the insurance authority migrated to SHA. Little did they know that now we have the social authority as one entity, and we have the digital health agency as another separate entity, but working together to make sure that digitization. Today we have something called Afya Yangu. You can download it. It's for patients. It shows your records. You can register. You can do pre-authorization messages you receive. Then we have the app Practice 360 for doctors. 38 systems brought together under that. So these rejections are among the reasons I've given you if you don't provide the right documents. Another key rejection I'll give you: if a mother delivers in a health facility, X, in any part of our country, private, public, faith-based, which is also very, very important.
Yes.
We have lots of, the system has also picked a pattern of doctors who you will find them in Homa Bay today, tomorrow you'll find them in Siaya, you'll find them in Garissa, you'll find them in Mandera.
In Wajir.
In Wajir, about 30 plus have been denied the access code of SHA. About 22 or something like clinicians have been denied. We had 6 facilities in a county where patients, 300 patients, were going through one day. So digitization is the key. So it picks patterns. It says, why is Jeff Koinange going to his facility every day, even in the primary health care? Yesterday we found a facility in one of our county, and we want to see the governor, where, and it is where walk-in, walk-out, outpatient, which is free. And we have seen Jeff is in the morning, he's at lunchtime, he's at 5.
Same person.
Yes, same person, which means it's part of the fraud.
Of course.
The pattern in this facility. I can give you an example. In Kwale, and I'm sure he's watching me, and we are catching up with that person. There's somebody whose dependents, his children, were 371.
Yeah. I saw that.
You saw that? Once we get all of him, we'll take him to the DCI.
Straight.
And he must show us the 371.
Children.
Yes.
Maybe.
In 3 years. And this is the problem, President Ruto is facing. Let me talk to you as a very senior, seasoned politician.
Yeah.
The problem President Ruto is facing from his competitors, more so some of, like my friend, former president, Uhuru Kenyatta.
Your good friend.
Our good friend.
Your good friend.
No, both of us.
Both of us.
You is your friend and your relative. But my good friend,
yes,
is a legacy problem. Because this universal health coverage could not take place during President Kibaki. And you know the reasons. The private insurers were buddies of President Kibaki.
Yeah.
You know them.
Yes.
So the Ngilu bill was dropped in cabinet. President Uhuru tried the pilot, Kisumu, Machakos, Nyeri, and Isiolo. He had the will, he had the commitment. But the same cartels in the NHIF frustrated him. He dropped the ball. President Ruto, in 3 years, has registered 29 million Kenyans into.
Yeah, but